Okay, so many of you have been asking about this, so let's deep dive into GLP-1 medications. Seems like everyone's talking about them lately, especially all this buzz about weight loss. We want to break it all down for you, get past the hype, and really understand what's going on. So to do that, we're going to be looking at mainly this article, Understanding GLP-1 Medications, Benefits, Uses, and Risks. We'll explore the good and the bad as always, so to help us do that, we've got our expert here.
Right, happy to be here.
So first off, for those who are maybe just hearing about these, can you just give us a basic, what are GLP-1 medications?
Well, GLP-1 stands for glucagon-like peptide 1, and it's actually a hormone that your gut naturally produces. It does a lot in your body. It helps regulate blood sugar,
Mhm.
appetite, even the way your body digests food. And GLP-1 medications, they kind of mimic this hormone, right? They amplify those effects. That's why they're often called agonists.
So it's like boosting something our body already does.
Exactly. And there are a few different types of GLP-1 medications out there, but they all basically work in a similar way.
Okay, that's helpful, but I think what a lot of people are really curious about is this weight loss piece. We keep hearing about these pretty dramatic results, so how is that working?
Well, think about it this way. Your brain has this hunger control center. It's called the hypothalamus. GLP-1 medications, they act on this area of the brain. They basically send a signal saying, hey, you're full, stay full longer. So you naturally start to eat less.
So it's not just about willpower then, it's like you're changing the signal itself.
Right, and there's actually more. These medications, they also slow down how fast your stomach empties. So the food stays in there longer, and that just adds to that feeling of fullness.
So it's kind of like a double whammy on that hunger. Huh, interesting. So are all the GLP-1 medications kind of equally effective for this?
That's a good question. While they do share that basic way of working, some are a bit more powerful in certain areas, like semaglutide, for example. It's sold under brand names like Ozempic and Wegovy. It's really well known for its effects on both that hypothalamus and gastric emptying, which leads to pretty significant weight loss, even in those clinical trials.
So that's where those big numbers are coming from.
Yeah, exactly. In studies, when you combine semaglutide with lifestyle changes, people have seen average weight loss of 15 to 20% of their body weight over just a few months. That's a pretty big change, so I get why people are excited about it.
Yeah, 15, 20%. That's significant. No wonder this is a hot topic.
hmm
But you mentioned before that these medications were actually first developed for something else. What was that original purpose?
You got it. They were originally designed for managing type 2 diabetes. They're very good at helping the body use insulin better and regulating blood sugar.
So it started as a diabetes treatment, but now we're seeing this potential for weight loss and maybe even more.
Absolutely. In fact, research is suggesting that certain GLP-1 medications, like liraglutide, it's marketed as Saxenda and Victoza, and also semaglutide, they might actually offer some pretty good protection against those major cardiovascular events, like heart attacks and strokes. And this is especially important for people who are already at higher risk.
Wow, that's huge. But we're talking about potentially impacting some of the leading causes of death worldwide. But while it all sounds amazing, I know any medication is going to have some potential downsides. What about side effects with GLP-1 medications?
You're right, no medication is perfect. And while these are generally well tolerated, there are some possible side effects, especially when your body is first adjusting. The most common one is nausea. It can affect a good number of users.
Nausea. Not ideal. Anything else that people should be aware of?
Some other common side effects are things like vomiting, changes in bowel habits like diarrhea or constipation. Sometimes you might get some abdominal discomfort.
So it sounds like mostly GI issues.
Yeah, mainly. Less common, you might get reactions at the injection site, headaches, and fatigue.
And are there any that are less common but more serious?
Yeah, there are a few to keep in mind. Pancreatitis, that's inflammation of the pancreas. It's rare, but serious. You could also have an increased risk of gallstones or gallbladder problems. And while the connection isn't totally clear in humans, studies on animals have shown a possible risk of thyroid tumors.
Wow. Okay, those sound pretty concerning. How often are those serious ones happening, and is there anything people can do to manage them?
That's important to remember. The frequency and severity of side effects really varies from person to person. Depends on the dosage, how long you've been taking the medication, your individual tolerance. But the good thing is, a lot of those side effects, especially nausea, they tend to go away as your body gets used to the medication. And a lot of healthcare providers, they start patients on lower doses to make that transition easier and minimize those side effects.
So starting slow and talking to your doctor is key.
Absolutely. It's about finding what works best for each person. And that takes close monitoring and open communication with your doctor.
Wow, we've learned so much already about these GLP-1 medications, how they work, their impact on weight loss, blood sugar, even their potential to help with heart health.
Yeah, it really is fascinating stuff, and we're still learning so much about what they can do.
I'm really intrigued by something you mentioned before about GLP-1 meds acting on the brain. Like the areas involved with mood and reward. It's not just about feeling full, it's about those cravings, those emotional eating patterns that can be so hard to break.
You're right, that's a really interesting area of research. Think about it. If these medications can affect those reward pathways in the brain, could they maybe help with things like addiction or eating disorders? It's definitely something to explore further.
It's amazing to think about those ripple effects going way beyond just weight or diabetes. But let's get practical for a minute. What about access to these medications? I mean, especially the newer ones, they can be pretty expensive, right?
Yeah, that's a real concern. Cost is definitely a barrier for a lot of people who could benefit from these meds. Insurance coverage is all over the place, and even when it is covered, the copays can be a lot. That's something we need to address if we want these treatments to be available to everyone who needs them.
It's a big issue, the healthcare equity. Okay, so let's say someone's thinking about trying GLP-1 medications. How do they know if it's right for them? What kinds of conversations should they be having with their doctor?
Well, first and foremost, you got to have an open and honest conversation with your healthcare provider. They can look at your health history, any medical conditions you have, risk factors, and really importantly, your own treatment goals. That's how they figure out if GLP-1 medications are a good fit for you and your situation.
So it's not as simple as just wanting to lose weight, there's more to it.
Exactly. For instance, if someone has a history of certain conditions like pancreatitis or thyroid issues, GLP-1 medications might not be the best choice. It's about finding the right approach for each individual.
Sounds like a very personalized approach.
Absolutely. That's why that open dialogue with your doctor is so important. They can guide you through the different medication options, talk about potential side effects, and figure out the right dose for you.
All right, so let's say someone gets the green light and starts taking a GLP-1 med. What kind of lifestyle changes, if any, are recommended along with the medication?
It's crucial to understand that these medications, while they're effective, they're not magic. They work best when you combine them with healthy lifestyle choices. That means a balanced diet and getting regular physical activity.
So it's not like you can just eat whatever you want and rely on the meds to do all the work.
Not at all. It's more like a teamwork thing. The medication can help regulate your appetite and blood sugar, but you still got to make healthy choices about what you eat and how much you move.
It's about building those sustainable habits for the long run, right?
You got it. And having a registered dietitian or a certified diabetes educator on your team can be really helpful. They can give you personalized guidance on nutrition, meal planning, portion control, all that good stuff, tailored to your specific needs and goals.
It's a team effort for sure.
Yeah.
So we've talked a lot about the potential benefits, but I think it's just as important to talk about the potential downsides too. What are some things we need to keep in mind when considering these medications?
Well, one thing is that you need to keep taking them to maintain the effects. If you stop, you're likely to gain the weight back.
So it's not a quick fix, it's a commitment. And are there any concerns about long-term effects? I mean, these are relatively new, right?
You make a good point. Short-term studies look good, but we're still waiting on those long-term studies to really see how safe and effective they are over many years. Like with any medication, you have to weigh the potential benefits against the potential risks and stay up to date on any new research or safety updates.
Staying informed, that's key. It makes sense to be cautious and learn as much as you can. Speaking of staying informed, there's been a lot of talk about the bigger picture with these medications, like how they might affect our healthcare system and even just how society views weight in general. What are your thoughts on that?
It's a really interesting question. The fact that more and more people are using these medications for weight loss and other things, it raises some important points. On the one hand, they have the potential to save a lot of money on healthcare costs. Those costs associated with obesity and all the health problems that come with it.
Makes sense. Preventing or managing those chronic conditions would save a lot down the line.
Exactly. But then on the other hand, if the demand keeps going up, there's a worry about putting too much strain on healthcare resources. And then we have to think about the bigger picture, how society views weight and how we manage it.
Yeah, it's complicated.
Hmm.
Are we moving towards a more medical approach to weight? And what does that mean for people?
It's a valid question. Will these medications become the go-to for anyone who wants to lose weight, even if they're healthy? And what about the stigma for people who choose not to use them or can't afford them? These are all important conversations we need to have as a society.
It's about finding that balance, embracing the medical advancements, but also addressing the ethical and societal stuff that comes with them. So even though these medications seem really promising, we need to be thoughtful and responsible about using them. What are some key things that people and their doctors should be thinking about when making these decisions?
Well, I think it's really important to have realistic expectations. These medications are powerful, but they're not a miracle cure. They can be a really useful tool when used the right way. But you really need a holistic approach that includes those lifestyle changes too.
Right.
It's also crucial to look at each person's overall health, any risks they might have, and their own personal goals for treatment.
It's not one size fits all, it's about personalized medicine.
Exactly. And like we've been talking about, open and honest communication between the patient and their doctor is crucial throughout the whole process.
We've covered a lot of ground on this deep dive into GLP-1 medications, from the science behind them to the impact they're having on how we think about weight management and metabolic health. But what about the future? What's coming next in this field?
While the field is moving so fast, there are a few areas of research that I'm really excited about. For one, scientists are developing even more effective and longer-lasting GLP-1 medications. Imagine taking a shot once a month instead of every week.
That would definitely be a game changer, just in terms of convenience.
Absolutely. And they're looking at different ways to deliver the medication, like maybe oral or inhaled forms. Those could make a big difference for people sticking with their treatment plan.
It makes sense. The easier it is to take your meds, the more likely you are to keep taking them and then actually see the benefits in the long run.
Exactly, but it's not just about the medications themselves. There's a lot of research going on about personalizing treatment with GLP-1 medications. Maybe using genetic testing or other markers to figure out who's most likely to respond well to certain meds and minimize those side effects.
So moving away from that one-size-fits-all approach and towards something more personalized.
Exactly. It's part of this bigger trend toward precision medicine, where treatments are becoming more and more individualized. It's pretty amazing to think about the possibilities.
It really is. It sounds like we're entering a whole new era of how we manage weight and metabolic health.
I think so. And it's not just about treating what's already there, but also preventing it in the first place. There's growing interest in using GLP-1 medications to prevent type 2 diabetes and other metabolic disorders in people who are at higher risk.
So shifting from reacting to problems to actually being proactive, intervening before they even develop.
Exactly. It fits in with that whole movement toward preventative medicine, focusing on keeping people healthy, not just treating them when they're sick.
It's all about giving people the tools and knowledge to take charge of their health. So as we wrap up this deep dive, what's the one thing you want our listeners to remember?
I'd say this. GLP-1 medications are a really big step forward in how we understand and treat metabolic health. They're not a cure-all, but they're a valuable tool when used the right way, ideally as part of a bigger plan that includes lifestyle changes.
Well said. And remember, the more you know, the better. Understanding these medications helps you make informed decisions about your health together with your doctor.
Absolutely. And stay curious. There's always something new happening in this field, new discoveries and innovations all the time.
That's right. Thanks for joining us on this journey into the world of GLP-1 medications. We hope you found this deep dive helpful. Until next time, stay curious, stay engaged, and stay healthy.